The other thing to think about, as you'll see on the next slide, is how the quality improvement, and particularly the quality improvement plan, link in with many other things that you're doing in your organization. So you'll see in this slide, you'll see the QIP program up there at the top. You'll see strategic plans. You'll see the public reporting on the right-hand side. You'll see how it links in with funding, because sometimes we're trying to access funding for new programs, and we're talking about what we're doing quality-wise to improve quality and safety and our effectiveness for our clients. We'll be working within legislation and regulation. You may or may not have regional accountability agreements. Those all link in. Accreditation spins off there. You'll see that as well. These are all intricately linked. And just like gears that they are showing us right here, if one moves, when the engine is functioning well, they all move. And if they don't all move, the engine isn't functioning well. And I just want you to keep that in your mind from a system perspective. The other thing that I really like about quality improvement is, you'll see on the next slide, it gives you an ability to stop and reflect on things that you've been doing for a long, long time, perhaps, that may be fairly effective. Edward Bear is getting from the top of the stairs to the bottom of the stairs. He is. He does it every day because Christopher Robin brings him down. But one day, Edward Bear would like to stop bumping and think about, is there a better way to get down the stairs? That's quality improvement. You will get down the stairs every day, and it might hurt a little bit, but you will get down the stairs. But quality improvement allows you to take that pause and say, wait a minute, is there a better way I could get down the stairs? So it's those if onlys. I like to call these ideas in your head if onlys. If only there were another way. There might be. Quality improvement lets you test that out. The next slide shows our pieces that within the E-QIP program we know are effective in order to be able to use quality improvement as a problem-solving, decision-making tool in your organization. So on the right-hand side, if you just click to the next slide, Ash, on the right-hand side, you'll see our foundational model for improvement. What are we trying to accomplish? How will we know changes in improvement? And what changes will we make that result in improvement? That feeds off of the PDSA cycle, which is our ability to test our ideas, to learn, to grow, and then back into our change ideas is this continual dynamic interaction between here's what we want to do, here's how we know we'll get there, and here's the change ideas we're going to try. Small rapid tests of change in order to figure out if we are actually improving, getting better or not. This model, this framework also includes the foundations to QI stage and tools, our big box in the middle there. And Ash, if you click again, I think there we go, my circle will move. This is a good diagnostic process. We prepare, we understand the problem, measuring and understanding your system, thinking about our solutions, testing those ideas, and thinking about how we can sustain and spread. So we're using that model for improvement, using this framework of a good foundation. And on another click, you'll see how this idea then of our experience-based design involving our clients, our tenants, our staff, our volunteers in helping us, particularly in the diagnostic, understanding the problem piece as a source of data. And Chris is going to talk a little bit more about some other sources of data today. But that's how all these pieces work together. One of the first things on the next slide, you'll see one of the first things that we really want to help in order to help to set us up for success in our quality improvement efforts is what I call how not to boil the ocean, or how not to try for world peace. So Edward Bear wants to fix getting down the stairs. Edward Bear is not trying to entirely redesign the house so that no longer do you have to use stairs in order to get up and down. He's just trying to figure out how to get down the stairs in a better way. And as much as we'd like to boil the ocean, solve world peace, make everybody healthy, happy, love and life, we'd love to do that. But our QI projects are going to help us to scale that down and scope it. And the way we might do that, my favorite, is a driver diagram. Go ahead, Ash, to the driver diagram. So, you know, if you know driver diagrams, I just put this in here as a very simple example. If you don't know driver diagrams, I believe we'll probably come back to this at some future webinar, or there are resources on the E-QIP website, I believe, or Google it. You'll find lots about a driver diagram. But basically, a driver diagram allows us to take something that we want to do on the left-hand side. By December 2020, I will increase the time I spend being physically active by 30 minutes per day every day. And we all know how simple that sounds, and I won't single you out and ask you all to raise your hands. I won't ask you, so you don't have to. How many of you have thought about this? But, you know, December comes and goes, and you're still sitting in the chair thinking about it. We've all done it. You know, I'm not being judgmental by any means. I've been there. Driver diagram allows us to break that down. Well, what will that look like? How will I do that? I'll walk more. I'll walk in place at my desk during the day because I'm sitting down too much like I am right now. Well, how will I walk more? What will make me walk more? I'll set goals and I'll find a reason to walk. Well, how will I do that? I'll get a dog. I'll wear a Fitbit. And when we move over towards the right-hand side, what's doable and scopable for me is maybe a Fitbit. Maybe a dog, that's still pretty big. Maybe I'll foster one for a while so I can test out the idea. Can I put a reminder in my calendar to stand up more often? That's a little simpler. So I can scope down to those things on the right-hand side that will lead to me being able to do what I said I wanted to do on the left-hand side. So my hows go left to right. My whys go right to left. So maybe I have a partner, someone I live with, a roommate, and I say, I want to get a dog. And they go, what? Why do you want to get a dog? Because I need a reason to walk. Why do you need a reason to walk? Because I need to increase the amount of walking I do. Why do you need to walk more? I'm not being physically active enough. That conversation will help you to scope. So I'm very passionate about driver diagrams, so I'll stop myself from saying anymore. I believe we probably will come back to this at some point in time, but Google it. The other thing that's really important, of course, is make sure we're working on problems, not symptoms. So a symptom is just telling us that there is a problem. And the symptoms are what we see above the ground. But what we know is underneath the ground, underneath what we see visibly, is the actual problem itself. And we want to spend our time on problems because we just spend our time on symptoms. And those of you who are clinicians know this well. We will never be able to solve the problem if we only treat the symptoms. We will have to understand why the problem is happening. And clinicians understand that way better than even I do. My next series of little slides here are showing you the difference between a problem and a symptom. So I don't know if you can see this. To the left-hand side, there is a man standing in the water. I'll tell you, he's standing on a vehicle. So what's the problem, I think, right now? Oh, there's a vehicle upside down in the water. Oh, okay. I'll get a tow truck and I'll get that vehicle out of the water. So on the next slide, oh, look, there's the vehicle. I had the right problem. Up it comes. Problem solved. Next slide. Look, this is really good. We've almost got it out of the water. The problem's level solved. Aren't we smart? Let's move on to the rest part of our day. Oh, wait a minute. We didn't properly identify the problem. We saw a symptom of the problem, which was a car in the water. We brought what we thought was a solution and we just applied it. And guess what? It didn't work. So now we do what we naturally do on the next slide is we watch it go in the water. Sure. We didn't collect any data either, by the way, right? There's a lot of people standing around who might have seen this happen. I don't think we collected any data because on the next slide, you'll see, oh, look, let's bring a bigger truck because we're sure we know the problem now. 2 vehicles in the water. Next slide. Bigger truck. Oh, look, maybe this is working now. We're getting vehicles out of the water. I think you all know what the next slide is going to show. Guess what? Still didn't identify the problem, right? Remember that. Are you just bringing a bigger tow truck or are we really trying to figure out what the problem is? So, little burst of theory. I'm going to be quiet now, and you're going to hear the real life experience around this from Chris.
All right, thanks. So now you have the theory, and what do we do? Where do we start when we're looking at our quality improvement plan? So I'm going to walk you through the process that CMHA Elgin Middlesex goes through on our QIP journey. You already collect a lot of information. So the easiest way to start your E-QIP journey is to look at what you already have. Most likely you're collecting perception or satisfaction information from Ontario Perception of Care, or the OPOC, maybe an agency tool that you're using. You probably have staff engagement or satisfaction information that you're collecting. And I know we all have MIS and CDS data that we have to collect, as well as our client records that usually can run reports. So there's a lot of information there as well. You're going to have information from your assessment tool, whether that's the OPAN or an agency tool that you've created or another assessment tool. And then likely, if we think administratively, you're going to have health and safety information, numbers, types of incidents that are reported, are evacuation drills being completed, and then other admin type measures you could look at are your turnover rates or your sick time rates if you're looking at HR. So then your next slide. Another place to guide you in your search for indicators are your program or service objectives. So when you're looking at your programs, you're thinking about what do we actually hope to achieve by providing this service or program. And you want to think about this from a bunch of different perspectives. So you're going to use the individual served perspective and what are we hoping that they get out of that program or service. And an example might be that you're trying to reduce substance use, you're trying to have them achieve set goals. And then you're also going to look at your program from the perspective of your partners or your stakeholders. And what are they looking for? This could include your funders as well. So when you're providing your service, what are others looking for you to provide? And an example might be the hospital's looking for you to provide diversions from ER, or maybe they want access to supportive housing. Another agency could be asking to co-facilitate a group. And then you're also going to look again from the perspective of a business lens. So you might want, in terms of access, 48 hours from referral to first contact. Or if you do provide housing or stabilization space, looking at your occupancy of your beds. And then all of these objectives have indicators that are attached, and you can use that to find more data. Next slide. All right. You now see that you have access to a lot of data already. What's next? So I'm going to share how I start when I'm looking to complete our quality improvement plan. And just so you know, we're going to be doing a deeper dive into data and target setting in the next couple of webinars. So be sure to register. They're going to be great, and it all helps. You now have a lot of data collected, and one way to organize that data is to think of the quality domains. So you're going to think in terms of safe, effective, person-centered, efficient, timely, and equitable. And you can also look at your strategic plan and your strategic directions, looking at your agency's operational plan goals, and look at all of that data and try to have at least one indicator for each of the quality domains, and then also for your strategic directions. And when you're looking at that, you're looking to try to see something that might stand out. Next slide. All right. So now you can organize that data and make a list of the areas that appear to be performing poorly and list them by their objectives. It just makes kind of organizing your thoughts a lot better. And if you don't have an objective for the indicator, just think again about why are you collecting that data? Why do you have that information? And if it does add value, then create an objective for it. So at that point, you're going to want to involve your leadership and others. You're looking at your indicator, and if it is an HR one, if it's about turnover, then you do want to talk to the appropriate people in HR. So if you're looking at a program indicator, then you want to talk to the program managers for that area, or coordinators, or whatever you call them in your organization, and talk about the data that you have, because they will have input, and there could be an explanation for why things look the way they are. They may not actually be underperforming. It could be that the model of delivery in that program area has changed from, and this happened to us, from one-to-one to more group facilitation. So their target was set around face-to-face individual contacts, and they were very much underperforming because they changed the model of care to groups. So we have to look at that. It could be that you have a dramatic rise in sick time use because there's been a pandemic, and there's a rationale behind a change in sick time. It could be there's a reason that a home was closed because there may have been a flood for a period of time and you couldn't fill those beds. So you do want to remove any of those indicators from your list where there is an explanation for the poor performance. But I do suggest that you keep an eye on those indicators just to ensure that that is actually accurate and the reason why they have performed poorly. And you can also change indicators for the next fiscal to reflect what's actually happening in the program. So like my example, you don't want to be collecting one-to-one information, you want to be collecting information on groups. And then now that you've gathered all of that information and you know what could be an area for improvement, you're going to list the remaining indicators with their objectives. The next slide. So I have my list, and now what? Now you're going to list your priorities, or begin to set those anyways. And this is another place where you're going to need more input and feedback. This time it's from your board and your leadership team. So how I do that is I create a table and I list the quality domains and our objective and our current performance. And I send that to our strategic leadership team as well as to the board. And they take that list and they're going to select their priorities for the year. I do ask them to try to select at least one priority indicator for each of the domains. And then I get all of that information sent back, compile it. We look at all the commonalities that are there. And I basically then set the priorities based on all of that feedback, sending that list to the board of directors for their final approval. And then once I get approval for that, that's the beginning step. We're all set to start populating our QIP based on the first cell that you're going to fill out, which is your aim, and then your current performance.
Thanks, Chris. That's amazing, and it's always you know, it just I can talk about theory all I want, but I actually see it in action is so important. So, you know, I don't want to make it sound like quality improvement simple, because it's not. It's a simple little complex process is the way I like to describe it. But, you know, it really always goes back to good old model for improvement, because after you've done all that great work that Chris talked about, you know, you got to go back and figure out your aim statement. What are we trying to accomplish? How will we know the changes in improvement, and what are the changes that we can test that result in improvement? You can recite those 3 questions in your sleep. You're doing QI, and if those are the way in which you begin to process what will we do next, good for you. But it's just those 3 questions. And around the aim, you're just trying to figure out what, for who, I'm not sure if it's who or whom, but either, what for who, how much, and by when. But you're not locking yourself down into how yet, because you're still going to continue to diagnose and still continue to make sure you're working on problems, not symptoms, but you need to know what it is you're trying to do, because the next thing you want to think about is who's on my QI team. And if you don't know what, for who, how much, and by when, you may struggle to figure out who needs to be with me on this journey. And it's okay if the people who are involved with you that got you to the point of being able to articulate that aim statement, it's okay if they then look at that and say, interesting, not my department, not what I do, not in my bandwidth. And it's also okay to recognize that at the point that you decide what it is you're actually going to focus on, you need to reach out for others, because you need somebody who touches the process that you are trying to improve each and every day. When I say touches, that may be a client, tenant, might be a family member, might be a staff person, might be a volunteer, might be all of those people. They need to be a part of your quality improvement team in some way, shape, or form, because only they know how this currently works right now. And you also need the person who has the ability to say, yes, you can change that process, or no, you can't. And maybe they're at an arm's length, maybe they aren't. But there's no point trying to change a process over which you have no control. You'll just end up being frustrated. And you want to make sure that you also consider the stakeholders. Who else is going to be affected by this, positively or negatively? And it's important to also make sure that they're on your team. So, you're looking for system leadership that can approve what it is you're trying to do. You're looking for technical expertise if it's a certain diagnosis you're focusing on, it's a certain type of programming, it's a certain type of therapy, you need that technical expertise. And you also need that day-to-day leadership, people who touch and feel this on every single day. The other thing I'll say is, don't be concerned when you need a champion. Sorry, that's the other thing. Somebody who is just like out there saying, yeah, this is it. And find a naysayer. Find somebody who from the very beginning is saying, that'll never work. We tried that 3 years ago. That's not going to fly. Have that person, because there's only two things that can possibly be true about a naysayer. They're either right or they're wrong. And either way, they're an important part of your team. Because if they're right, guess what? They just saved you a lot of time and effort. And if you collect data that addresses what their concern is about, you'll know very quickly if they're right or wrong. And if they're wrong, they might become your best ally. Because suddenly now they see, oh wow, what I was concerned about isn't such a big deal, or it isn't real, and now I'm going to help you. People who are thinkers are sometimes not doers. So sometimes when you are designing your plan, your project, they may not be the same people who want to go actually and run the PDSAs. That's okay, because you want people who are enthused and want to do the work. It is, as you'll see on the next slide, something that is, and I mentioned this at the very beginning as well, it's not a one and done. It's not a, if you're doing QIPs, it's not a, we've got to get this QIP in by such and such a date. So, we're going to worry about this in the month of March. You can see how even when you do have that deadline, that this is an annual cycle. That, I guess you can start at the bottom, I guess Q4, you're submitting your QIP and just realizing I need to update the slide because we're now on Ontario Health, and this is a slide that we use across all sectors. So hospitals, long-term care and primary care, who do have that requirement to submit quality improvement plans. Your sector is amazing and voluntarily doing this right now and sharing your quality improvement plans with us. But it's in April 1, but you go back up, there's April to June, test and implement change ideas, July to September, guess what? Implement and monitor change ideas. October to December, guess what? Make sure you're looking at your progress. What's your data? What's happening? You'll probably hear if there were going to be any indicator changes for the following year, and back you go into the cycle again. So it's like Hotel California. You can't check out and you cannot leave. Quality improvement continues on. Now, we're not trying to just paint that, this is going to be skipping through a meadow, the happiest thing you've ever done in your life. There will be challenges along the way. There will be. We are asking people to change their behavior. Our change ideas, and we'll talk about this a little bit on the next slide, our change ideas will ask people to change their behavior and do things in a different way. And again, I won't single you out, but I don't think there'd be too many of you that would raise your hands if I said, how many of you like change? How many of you like it when you have to do something differently and it may not even have been your idea? So, there are some solutions. Some of the challenges we can mitigate. Some of them we just have to acknowledge and think about what is it that we're going to do when they present themselves. So being as clear as we possibly can about what it is the quality improvement plan is about, what the changes are, what the value is, what that's going to mean to somebody's workload, how we're going to help people to build capacity to be able to do the new things that we're going to ask them to do, communicating clearly. Making sure people understand their roles. What is it I do now? What is it I'm going to do in the future that's different? What does she do? What does he do? How is that going to change? How will I relate to you in a different way? And it's actually that between roles clarity that's even more important. Forming, storming, norming, conforming, adjourning, whatever model of group development you like, people don't always play nicely in the sandbox. And so anticipate that. Know that people are going to struggle. And often those struggles are where the biggest learning comes from. It's when you actually, that means that you care so much about this that you're gonna battle a little bit. Because I care a little bit differently than you, or I see this differently than you, because if you didn't care, you wouldn't battle, you'd just give in. So it's good, because it means you care. Making sure that leadership is on board and is collaborative. And I'm going to state the obvious here, but if you are working interagency, This is more difficult, right? Organizations, agencies have their own strategic plans and their own accreditation and all those other things. Think of all those cogs that I showed you back at the beginning. Every organization has those cogs. Now you're going to try and work together, and maybe you're even interlacing your cogs a little bit, and that's going to be hard. And you're going to be working with people that you don't know, and they might even have different regulations, different funding requirements, because maybe they got different funding streams. I'm telling you stuff that you know already, but this is a level of complexity, and there will be conflict, right? Maybe it's because of power or hierarchy, maybe it's because of past history, maybe it's because of experience. And this goes back to my point earlier about this is not a team building exercise. This is not, you're going to have to sit beside your brother until the two of you can get along. This is not going to work. This is going to be hard, and it's going to ask you to change behavior and think in new ways. And so conflict is going to arise. You're all fantastic conflict managers. You do it every single day. Use what you know. This will happen. The other thing that we know around those challenges on the next slide, and Chris, I hope you don't mind, this came from Chris's list, you're going to get overwhelmed sometimes. Holy crap, what do I do with all this data, right? Remember what Chris said, think about, line it up against those quality dimensions. Think about, how can I sort this? Use an impact effort grid. And again, we don't want to overload and overwhelm you today. So if you don't know what an impact effort grid is, Google it. You're going to find it's very simple, 2x2 decision-making tool. Think about how to narrow it down. Scoping is important. Don't boil the ocean. Feel free to use that boil the ocean term and call each other out on it. Don't boil the ocean. And, you need the engagement of your leadership and your board. So if they're not getting you feedback, if you're not getting that engagement, maybe it's your messaging. How can you message them in a different way? How can you help them to see the importance of this? Maybe they need a few of the slides out of this deck right now about how quality improvement is a provincial priority. Maybe they need somebody, maybe they need to hear from one of your clients or your tenants or one of your volunteers who can talk about this. Think about how to deliver the message. You are wonderful communicators, and you're wonderful communicators because you know that the same message delivered exactly the same way to two different people is not going to have the same effect. So think about that. Use what you know because you are so good with your emotional intelligence, and think about the way in which you deliver your messages. What are the keys to getting started? I hope you've been kind of making some little jot notes as we've gone along, and I hope we've dropped a few of these nuggets for you already. You know what? Be curious. If only there was another way of getting down the stairs. Be Edward Bear. If only, if only, if only. Look at your data, including some stuff that you maybe don't like to look at because it's complaints. But don't be afraid to look at compliments either. You're doing good stuff. Look at that as well. Look in areas where one person compliments you and one person complains. I call that variation. Variation suggests an opportunity for improvement. Think about that. You go to others. One of the faculty that we used to use in the ideas program used to say, if you think you're the first person that's looking at this problem, think again. Use our dear friend Google. How do I decrease wait time for services for CBT? Google it. And I'd be shocked if something didn't come up. May not be all good ideas, may not all be evidence-based ideas, but at least they're ideas. They're ways to get started. Talk to everybody. Ask your volunteers, ask your clients, ask your board, ask everybody. And, ask them about what have you seen in other places. Actively seek each other out. Those of you who are involved in the communities of practice, that's what that's about, right? Actively seek each other out, both for what does work and what doesn't work. QI is a team sport. It's a team sport without competition. So it means that we use teams, we use our own team, and we use other teams to try and make ourselves all better. So again, that's enough from me. Let me pause there. Let me just do one more thing, and then we'll go to questions, and I'm going to pass to Rishi at that point. Let's just go to the next slide for a minute, just because I think one of the things that you're maybe going to ask me is, like, what's the next step? So we just want you to know that this is what the next webinar is going to be about. And that's part one of measurement, counting what counts. So that is the next stage, and I just wanted you to see that. And now, Chris, who is our wonderful chat box watcher, any
Hi.
questions that you see?
Well, the chat box is quiet, but maybe people are contemplating, and maybe while people are doing that, I have a question of my own for Chris Babcock. Chris, in your first, might have been your first slide, you were talking about underperforming or poor performing, I guess, program offerings. I'm forgetting the word that you used. What measures, or what's your decision-making process for you that you can share with us around the decision-making to let you know that something is in fact underperforming or performing poorly? I mean, because these are essentially relative measures, right? Just like something could be doing great. So what do you use to compare one to the other to help you come up with the idea that something is performing poorly or underperforming?
Yeah, I guess we use a variety of different ways to look at that. So the target setting and the benchmarking, and I know we're going to go into a lot more detail in the next webinar on that. But if I can think just really simply of, say, our OPOC, or Ontario Perception of Care tool. So we have access to the provincial scoring, and we can compare to the province and see whether we are performing on a par, better, or worse. If we're performing worse than the province, that's an area we would likely want to look at. Even if we're performing better, if internally we look at that and say, but we've seen a decline in our score over the last 6 months, the last year, the last 2 years,
right,
we need to look at this. So internally, when we look at our staff satisfaction or engagement, that again, that's an internal target that we're setting. We could do some research on what other agencies are performing at, but we do that internally, always looking for a minimum of 85% agreeing or strongly agreeing to something. So we do that internally. Occupancy, we would base on the city. What is our city's occupancy rate? Well, therefore we should be the same as or better. So it really depends on what you're looking at, where you look to see, to compare.
Yeah, I think there's really good information for people to use multiple sources of comparators, right? Not just, well, we're doing poorly compared to last year, let's try and do better. Okay, well, that's good, but there are others you can certainly employ. And I like your comment about, well, what are the provincial targets, benchmarking, and of course, I like your idea. I never would have thought of your third idea there about comparing yourself to the system of care inside your own community, for example. And how do we measure up accordingly? Good.
I can just add to what Chris said, and Chris says, like, I'll just pluralize it because I'm going to bump off both of your points there. And benchmarking and looking at provincial averages, fantastic. And Chris Babcock, I liked what you said about even if we're doing better, how could we even improve on that? Because let's always remember something about benchmarks. Benchmarks aren't targets. So if across the province, we're performing at 60% of whatever, 60% of making widgets. It doesn't mean that 60% is good. It just means that's what we're currently doing. We're 60% good at making widgets. I kind of think we should be 100% good at making widgets. So that tells us we're doing, it may tell us we're doing as good as everybody else, or it may tell us we're doing poorly collectively. And therefore we need to look at that. So I 100% compare, but don't get fooled that benchmarks are what we're aiming for. They are not targets. And Chris made a good point about that.
Good reminder, yeah.
Yeah, actually I can give you an example too of where we as a leadership team, we're looking at the data from HR and our sick time use. And I would probably say 70% of the people at the table were saying, we have such a big problem with sick time use. How can we fix this? And so I took the time to go in, dig down into the data and find out, is it one program? Is it the organization? And a little bit was one program, but then I also looked at the city, the province, and Canada's statistics around healthcare average use of sick time. And we were below well below actually the average use of sick time in our program type. So and there was actually only one program that seemed to be a little higher. It actually ended up not really being a problem after we looked at that. So Yeah, it's
Yeah,
important.
and I'll just add to that, you know, Chris, an example of my own was it was actually a family health team that were getting complaints about their phone system. And some of you who've maybe tried to phone may have complaints about your family health team's phone system. I don't know. Nobody likes voicemail or the routing. They had 86 complaints about their phone system, their routing. So they were very ready to invest in a new phone system because they believed that 86 complaints was too high. Probably is. 86 complaints in a month, I think it was. Probably is. And they were very ready to invest a lot of money in a new phone system. And then somebody wisely said, do we know the breakdown of those 86 complaints? Well, no, we got 86. That's horrible. You probably know where this story's going. 85 of the complaints came from the same person. So, you know, it's still important because it was, you know, upsetting that person. But when you know that 85 of the 86 complaints came from one person, that's a different source of data. It's still important, but it's different than if 86 people had complained. Any other, Chris, or shall
Well,
we?
just the closure on the tow truck story when you have you know,
Yeah.
a farewell message for all of us.
You know, I saw that message in the chat box, and if I could have Googled fast enough, I don't know.
I think I asked you this. I think I asked you this months ago, and now that you mentioned it's come back to me that we don't know
I
how it ends. Like,
know.
are the tow trucks still there underwater?
Yeah, I don't know, and I am going to see if I can find out, Chris, because you did ask me before. Thank you.
Okay.
I'm going to pass to Rishi, and Rishi's going to take us through some kind of what's next kind of stuff, because you know this was only chapter 1, and this is a big story.
Yes, thank you, Alice, Alice and Chris for opening our kickoff for the season opener. And as Alice mentioned, it's a chapter first of our many. So please do share this with your colleagues in your organization and others. Get this word out so that we can learn more about QIP and how the fine details about each component. So we have every participant today will get the slides as well as the recordings and resources. There are great tools that you can definitely use in your QIP. Next slide, please. Please do check out the E-QIP website. It has many tools, templates. We have a community of practice. Both we have 3 different ones for E-QIP. There's a supportive housing group. There's an advancing QI, and then there's a general. So do check out and sign up for our newsletters. We have an active Twitter account. Please do follow up. We do post many upcoming activities and events on there. So do follow up that. Next slide, please. Like today's webinar, we have previously recorded many other webinars over the summer. We had the QI on the fly just to keep how organizations had the rapid QI during the pandemic, and other webinars for Model for Improvement. They are short, half an hour series, so you can definitely watch when you have some spare time. Sign up again for the newsletter, as I mentioned. We do share about quite new events that are coming up. So next slide, please. And last not but the least, please help us give your feedback so we can definitely improve upon our deliverable. We always like to practice what we are talking QI on the fly. We want to improve our presentations. We want to include what you want to hear from us. So share your feedback and do share your thoughts with us. And next slide. And thank you for joining us today, and stay safe. You know, it's ongoing, so please keep the COVID under control, and we will hope to see you around the next webinar.
So I'm just going to interrupt you, Rishi, because now Chris has asked me again. So I've been Googling. You may have seen my eyes on another screen here, and I just put in the chat that there apparently is a YouTube video I was going to watch, but I just found a Snopes. Is it Snopes? Is that how you say it? Crane accident. This took place in Ireland at Roundstone Pier. I'm learning things here too. What does it tell me? That It may all be a hoax, so I'm learning something about my own example. But oh, I just lost the image of what it was going to try and tell me here, of course, because it's got all these ads in it. But the fact that it's on Snopes leads me to believe that maybe the whole thing was a bit of a hoax. But I will. Here we are. The final.
Don't spoil it, Alice. Don't spoil it, 'cause it's a
Okay.
great, it's a
Keep the
great metaphor.
suspense.
If
Yeah.
All
you
right.
if you find out the truth, you might be disappointed.
Yeah, I might be. Oh yeah. Okay. You know, go look for yourself, but I'm going to use new pictures now. That's funny.
Was
Thanks.
there
Thank you,
any
Gary.
was there any Guinness involved, Alice?
There's some photoshopping involved, apparently.
Oh, okay.
Uh-huh.
All right.
To be continued.
To be continued. Yeah.
Yeah, yeah. Thank you, everybody.
Thank you, everyone.
All right.
Thanks. Bye.